In this video, I'll talk about preterm labor, particularly premature rupture of membrane, breaking of waters early. What is a preterm labor by definition? Actually, 37 completed weeks of pregnancy is known as term pregnancy. Any pregnancy below 37 weeks is a preterm. So if somebody goes into spontaneous labor or induced into labor, or she goes into labor because of breakage of waters, then it is known as preterm labor. Now, breaking of waters can happen in two ways. Number one, it may constantly go on leaking and leaking, and it can wet the undergarments, or it may come out as a gush. And in these cases, we know that the water has been broken. It would be a continuous flow. How does waters get broken? Now, waters get broken normally due to some infection. In the sac in which the water is there, the membrane of that sac, the lining of the sac is so tough that we cannot rupture it or break it. We break it, if necessary, only with sharp instruments. So only if there is infection with bacteria, which the enzymes of the bacteria cause thinning of this membrane, and it can then break spontaneously. Somebody who had a previous history of breakage of water, they have more chance of breaking of waters. Normally, the incidence is about in 6% of cases. So if the breakage of water happens, then this sac becomes open to outside, to the external influences, to the loads of colonies of bacteria in the vagina, which may go up and infect the baby. So in modern obstetrics, what we have to do, we have to deliver the patient within the 24 hours after breaking of the water. So if you ever break water, immediately inform your doctor, and also don't take any food or water by mouth, because once you go to the hospital, you may need an emergency cesarean section immediately, for which an empty stomach would be important. Now, what happens, why we are doing this urgent delivery within 24 hours? Because if there is breakage of water, the bacteria going in can infect the baby and can damage the baby very badly. Especially more the pregnancy preterm, more chances of damaging effects can be there. The damaging effect depends upon two things. Number one, the immunity, the inherent immunity of the baby, and number two, the virulence of the bacteria which has caused this breakage of waters. So this is very important that these two factors interact and lead to this ultimate effect or ultimate result of a preterm rupture of membrane. We call it a preterm rupture of membrane. And if it is so, immediately inform your doctor. To know more of these topics, please subscribe my channel, and please like this video so I can dish out more for you.